lovelies. Hope you guys are doing well and staying safe. Today, as you can see, I wanted to talk to you about red light therapy and how it helps with hair regrowth and basically treat hair loss. So let's begin. So LED light therapy, what does it do? It increases blood flow to your scalp, to your hair follicles. It reduces inflammation and inhibits DHT production, which is shown to be involved in alopecia or androgenic alopecia. And red light therapy is basically what I'm getting now. Is it's effective. So red light therapy is shown to be safe, effective, and a treatment option for hair loss. It's gaining a lot of popularity with professionals and in the public. It's backed by strong peer-reviewed research, and treatment have increased hair count and hair density, hair thickness for both men and women. And all these benefits come without any negative side effects. So what I'm going to do today is break down the research, what is available, and so you can decide if this is an option for you. So let me give you an overview of what I'm talking about, the LED red light therapy. Just like plants use sunlight to heal and grow, our body is able to harness specific wavelengths of light and turn them into cellular energy at the cellular level. This in turn stimulates body's natural healing process. So this is where the red light therapy comes. Red light therapy, or in scientific term, photobiomodulation therapy, or just PBM, it delivers therapeutic dose of red and near infrared light in an efficient full body treatment. When light is applied to the right wavelength and duration, your body cells react by producing more energy. So instead of having just enough energy to get by, your cells get a boost to allow them to repair, replicate, and do their jobs. When all the different cells in your body do all do their job really well, you get a lot of health benefits, such as decrease in pain and inflammation, faster recovery and less soreness after exercise, faster recovery after injury, reduce fat, and cardiometabolic. Many people who uses it, they report better sleep, reduce stress, and improvement in their mood. So what are some of the benefits of red light therapy? As I mentioned before, it improves muscle performance. So that's why you'll see, I don't know if you've seen ads, but if you go online, you'll see there are actually devices you can get, like red light therapy for pain relief, and it restores joint motion, muscle relaxation, relief from pain and inflammation, increased circulation. And this is where the hair loss part comes in, treating the hair loss. If it increases circulation in your hair follicle, or in your scalp, it stimulates your hair follicle and help it grow. So device like this, the eye restorer, I talked about it previous. Red light LED light therapy, like this one I'm using, it delivers safe, concentrated wavelengths of natural light to your scalp with no chemicals, UV rays, or excess heat. And this red light, or near infrared wavelengths of light, stimulates the mitochondria in your cell, similar to natural sunlight, reducing the oxidative stress, and increased circulation. So your scalp or your body is able to make more energy to power itself. And making the energy more efficient throughout your body improves your physical function, speeds the healing process, and lowers inflammation and pain. And it has a major stimulating effect on your cell, which play a big role in the regulation of hair cycle and growth. Research have shown that red light therapy is an effective natural or effective treatment for hair loss. Hair loss is one of the most common effects of aging, impacting both men and women, impacting over half the world's population. More than 50% men and over the age of 40 are affected by androgenic alopecia, and over 75% women over 65 also suffers from alopecia. Fortunately, red light therapy offers a safe option for preventing or reversing hair loss, and it is backed by a lot of peer-reviewed clinical studies and clinical trials and different types of meta-analysis. One of the studies examined 8 different clinical studies comprising of about 11 double-blind randomized clinical trial, where basically the researcher who is doing the study and the people who are participating don't know what kind of treatment, if they're getting the actual treatment or a placebo or the standard of care. So the analysis showed a significant increase in hair density for people who were treated with red light therapy. There was also a significant increase in hair growth with the red light therapy treatments versus sham or placebo treatment. The study also showed that the red light therapy increases hair growth in both men and women, and it is effective with both short-term and long-term treatment. And it didn't report any negative side effects or complications. So the study was published in August of 2019 and it's called The Comparative Effectiveness of Low-Level Laser Therapy for Adult Androgenic Alopecia, a system review and meta-analysis of randomized controlled trials. Another meta-analysis from 2018 reviewed recent advances in non-surgical treatments for hair loss. They examined 22 studies by comparing the red light therapy to other common treatments such as hormone regulating drugs like finasteride and dutasteride, and they concluded that red light therapy was much superior treatment. Moreover, while many of the drugs reviewed in this meta-analysis had negative side effects, the red light therapy was found to have none. So as you can see from these studies, that it is a very shown to be an effective treatment without the worry of the side effects that you get from drugs. So as I mentioned before, it improved hair count, density, thickness, and strength with red light therapy. Is another meta-analysis study in 2017. They analyzed 11 studies and where overall 680 patients were treated with red light therapy for hair growth. The researchers noted significant improvement in both hair count and density. Additionally, hair thickness and strength were also improved in those treated with red light therapy. People who were treated with red light were asked about their experience, and on the whole, they responded positively to the treatment. 2019, researchers conducted a 6-month study that examined man with male pattern baldness and changes in their expression in their dermal papilla tissue, which is both a chemical and physical niche for epithelial cells that regenerate the cycling portion of hair follicle and generates hair shaft, basically. And these tissues are responsible for hair growth. Patient received 25 minutes of red light therapy every other day which is what I do. And by examining which proteins were upregulated, researchers found that light therapy promote hair growth and reverse the miniaturization process of balding by enhancing this tissue function. And a 2014 study showed men who used red light therapy had a significant increase in their hair count, and they had a 35% increase in hair growth and no adverse side effects. Now, treating female pattern baldness, which is what I have, with red light therapy, think about it. 10 years ago, the options for women were very limited, with more attention being given to female pattern baldness now, and many studies have looked for methods to help hair growth. So to study the effectiveness of red light therapy, research have been done with double-blinded randomized clinical trials. In the study, 47 participants or female participants had area of their scalp trimmed to 3 millimeter height, and the area was tattooed and photographed, and one group received red light therapy every other day for 60 days. The second group received a sham treatment. Upon completion of the studies, researchers found that there's a significant increase in post-treatment hair count in women who actually got the red light therapy, and there was a 37% increase in hair growth in the red light therapy group. Again, no adverse events or side effects were reported in the study. Another 2017 study looked at the effects of red light therapy versus minoxidil, which is the common treatment for female pattern hair loss. I was told to use it. You probably were using it or used it. And the study included 45 women, and they were broken into 3 groups: those who received the red light therapy, those who received the topical ointment, and a combination group. And researchers concluded that the red light therapy treatments were effective. The use of both red light therapy and topical ointment like minoxidils were recommended by the researchers to further improve the hair growth. What does all this study shows? Red light therapy is safe, effective treatment for hair loss, and red light treatment have shown to increase hair count, boost hair thickness, and help people improve their appearance and confidence level. If you struggle with hair loss and have unsuccessful treatment, you may consider doing this. This is one investment I made on my hair loss that I am very happy with. As I mentioned, when I initially started losing hair, you saw the bald spot. I did the minoxidil. I'm still taking the spironolactone, and I also did the red light therapy. After minoxidil didn't work on me, the only thing that I stuck to the initial time was the LED treatment, then the medication, spironolactone, and the natural hair oil mixture that my mom made. So that initially, and you saw the before and after, it made a dramatic improvement in my hair count and my overall hair. And after that, every time I had telogen effluvium, I didn't use the red light therapy. I just stuck to the natural treatment and continued the spironolactone, and it worked. As I mentioned to you before, recently I had COVID, which basically felt like it just activated the hair fall that I have been having. And initially, I just let myself heal to recover from COVID. And however, once I started getting better, I started using the natural hair oil and the mixture treatment my mom made. And I saw it that my hair fall started getting better. Then I had surgery, which I mentioned last time. And the surgery, it feels, and for couple of weeks, I couldn't brush. My hand was in a cast, so I couldn't take care of my hair at all, and that kind of aggravated the hair loss. I started losing more hair, and it's just felt. Even my mom, she was like, "Yeah, you started. This is the same level of hair loss you're getting now that you got previously," and she said, "Yeah, I need to take care of it." I still I continue to use the hair oil treatment and the pre-hair regimen that I do before washing my hair, and I'm still taking the spironolactone, but the thing I'm doing now is using this red light therapy. I haven't used it for long enough. I just probably used it less than a week now. I'm gonna use it. This is how I did before, and I'm gonna do this time too. 25 minutes every other day. And I will keep you informed how I'm doing in terms of the hair loss and hair regrowth. And before I can even think about regrowth, I need to stop the hair loss. And right now, I am taking care of, I'm still recovering from my surgery, but I am trying to do the hair treatment and the LED treatment, and I'm hoping it will do the same result it did the initial time, and I'll keep you informed. So I wanted to give you like a detailed information on what red light therapy does for hair loss. If you have used it, please do let me know if you found it effective, if it helped. If not, let me know too, and I will continue to let you know how I'm doing and update you about my hair loss and my nightmares and my triumphs. One thing I wanted to add to my whole conversation about LED light therapy for hair loss is that just remember, keep this into your mind, that each things affect people differently. Each people have different reaction to any stuff or any treatment. What works for me might not work for you. And the light therapies I was talking to you about has been cleared by FDA. It doesn't mean it didn't go through the same rigorous processing for clearance that usually drugs do. So usually when the Food and Drug Administration or any kind of drug approval agency, when they look at prescription drugs, they have to those drugs have to demonstrate and show efficacy before they're sold, but not so for these devices, cosmetic devices. They generally can get clearance if they show they're at least functionally equivalent or equal to something or close to something that is already on the market. And these LED lights that has been cleared for people with lighter skin. There hasn't been much study or enough study for people with darker skin like me. So they also may not work for other skin types of hair or other types of hair loss. So like alopecia due to autoimmune condition like lupus, RA, rheumatoid arthritis, or chemotherapy, or for those who already completely bald. So you have to keep that into account when considering if you want to use a LED light therapy for hair growth. It if you ask dermatologists or cosmetic surgeons, they advise again LED treatments for anybody with a metabolic condition called porphyria, or if you have something that makes you more sensitive to light, particularly red light. Some drugs may cause photosensitivity as well. So before using LED light, please talk to your doctor, talk to your dermatologist, and make sure they are okay with you using the LED light for hair growth. I learned about this from my doctor, and she recommended that I try this out, and I found it worked for me. So talk to your doctor, make sure that you are the right person, or it wouldn't affect you harshly. And I just wanted to add that and make clear that what works for one person may not work for somebody else, and it might not be might not be an ideal treatment for you. So talk to your doctor before making a decision to use anything like LED light therapy. So I hope you found this helpful. Please do let me know in the comment what else you want me to talk about. If you find my videos helpful, don't forget to subscribe, hit the like button, send your comment, and also please share so I can, and I would love your feedback so I can create more stuff that be helpful to you. So until next time, take care and bye. Happy viewing.